If you've been battling dark spots or melasma and feel like nothing is working, you are not alone. Hyperpigmentation is one of the most stubborn skin concerns that I treat. Today, I am breaking down the 3 best products and treatments for fixing dark spots, especially in the setting of melasma, that actually work. And of course, I'm saving the most effective topical treatment at the end. If you have dark spots for acne, I'm gonna make a separate video on that, so stay tuned. Let's get into treating hyperpigmentation and melasma. Hyperpigmentation and melasma are tricky because they're driven by multiple factors. And just to kind of make sure that we're all on the same page, I just wanna clear definitions of these words. So hyperpigmentation literally just refers to increased pigment in the skin. This can manifest as dark spots after acne, or can manifest as patches of melasma, or can manifest as sun damage. Dark spots is just another term to describe pigmentation on your skin. We think of dark spots when we think of post-acne marks, but it can refer to really anything that's dark on the skin. And like I mentioned, melasma is a specific form of hyperpigmentation. I think it's one of the most stubborn forms of hyperpigmentation, and it manifests as like larger brown patches on the skin. Hyperpigmentation, especially melasma, can be tricky because they're driven by multiple factors. These include things like UV exposure, heat. This is especially relevant for melasma. Hormones, also really relevant for melasma, like increased estrogen from birth control or being pregnant, inflammation, and genetics. If you're only treating the surface without addressing the underlying causes or triggers, results can be limited or short-lived. I have to say this up front, no pigment treatment works if you're not protecting your skin from the sun and from the heat. So that means daily broad spectrum sunscreen, reapplying your sunscreen if you're outdoors for prolonged periods of time, wearing hats and shades when possible. If your pigment keeps coming back, sun exposure is usually part of the reason. All right, let's get into some of my favorite over-the-counter ingredients that can lighten pigment. One of the most effective topical treatments for stubborn pigmentation is cysteamine. So cysteamine works differently than traditional skin lightening ingredients. It reduces melanin production through multiple pathways, which makes it especially helpful for melasma. A well-known option that I do like is Cysteamine. It does require consistency and patience, but for many patients, it can significantly improve pigment over time. Another category that I really do like are resorcinols. These are powerful, but a little lesser known. One example that I do appreciate, and I think it's been getting a little bit more hype recently, is thiamidol. This is found in the Eucerin Radiant Tone collection. There are other types of resorcinols. There's phenylethyl resorcinol. There's also 4-butyl resorcinol, which you can find in Dr. Idris's Hyperfade line, her Hyperfade Active Seal. Resorcinols help reduce melanin production and can be very effective when used consistently. Tranexamic acid is excellent for pigmentation, but only if it's formulated correctly to penetrate the skin. I am a fan of this technology called TX Vector, which you can find in Personal Days Just Like New Adaptoid Serum. Tranexamic acid is also really helpful like post-procedure when your skin is more amenable to like letting it get into the skin. Where tranexamic acid really shines is when it's prescribed as an oral medicine. Exfoliating acids like glycolic acid, mandelic acid, lactic acid, these can help speed up pigment fading, but overuse causes inflammation, which can worsen hyperpigmentation. So just be careful with finding that balance. Gentle and strategic is the goal. For the most stubborn cases, the most effective treatment is still a compounded combination of Tretinoin and Hydroquinone. This has to be prescribed and monitored by a dermatologist. This targets pigment at multiple levels and delivers the most reliable results when used consistently. This is actually something that I prescribe through DermClick when it's appropriate for that patient, because supervision and proper formulation really do matter. And the other prescription I like that I mentioned before is oral tranexamic acid. In-office treatments, of course, can be very helpful. These include things like chemical peels, lasers, specifically the pico lasers, and microneedling. But these work best when the skin is prepped properly and pigmentation is well controlled first. And I really want to emphasize this when it comes to procedures, that procedures do not replace a consistent daily skincare routine. I can't tell you how many times patients will do a procedure and they don't go back to their skincare routine and their melasma comes right back. So skincare consistently and daily is really the most important foundation for treating hyperpigmentation and melasma. So know that hyperpigmentation is manageable, but it does require patience, protection, consistency, and the right approach. If this helped clarify things, let me know in the comments, and please subscribe to be notified when I post my next video. See you then.